process.
Yes, because initially, because these were initially presented in therapy offices, right? And we started to see, well, wow, it can change pain as we know it, or digestive disorders, or anxiety, or and other what we call comorbid factors, things that go together. Because anxiety and back pain go, or the depression and back pain or neck pain, But many other things started to happen, and we realized that long sought after doorway between the conscious and the unconscious experience. I mean, literally a doorway into this realm, right? And if these unconscious, remember, often experiences, and even if somebody's conscious of them, they really don't know what to do with it. But the big doorway was going into the unconscious, right? And giving people new tools to deal with it. So yes, then it started to attract a whole new category of people looking for transformation, right? People that said, I've done spiritual practice, or I've done this and that and that, and that one day, that one time with you, I experienced so much more than I've ever experienced before. Or when we went in there, I realized, boy, I really didn't really develop the tools to deal with that.
Is that the superconscious state that you refer to?
Well, the superconscious state is what happens after, but the doorway of the conscious, people start to realize what they're carrying, right? And of course, when you start to realize that and you don't know about it, you get concerned or frightened. And you realize maybe most of your life has been based on protecting that feeling. Right? That sense of worthlessness or despair or shame or just pure unadulterated fear. I mean, you can imagine all of a sudden just pure fear, and the room is not on fire, there's no perpetrator, there's no dog. But if you don't know how to interact with that, you're going to shut it down, you're going to dissociate and close down. And in mental health, unfortunately, they're petrified. I've worked with many mental health people about bringing things up that they can't seem to have kind of handle on it. And if you can't regulate the autonomic, if you can't generate a spontaneous release, maybe rightfully so, It's like, why bring that up in somebody if you don't give them a real form of resolution? And that's where the schools, from the somatic experience schools and Ogden School, where they started to realize, whoa, there's something that happens spontaneously. It's good, it's innately good. You don't have to fix anything. You just have to get the person to interact with this thing and have it spontaneously. So they use a lot of, guidance and telling you, okay, let's put your attention over there, and what does that feel like? And then when something starts to come up, to make you aware that that's okay. So if you start shaking or trembling, right? If you laugh or you cry, it's normal, it's good, right? And so, like I was telling the yoga experience, or many other experiences that happen, and it often got misconstrued, because you can go way back to Shakers or Quakers, whatever, and people thought they were having communion with God,